Hello to everyone watching us on WHO.
This virus will continue to evolve and threaten our health system if we don't improve the collective response. Right now, Delta and Omicron are twin threats that are driving up cases to record numbers, which again is leading to spikes in hospitalizations and deaths. I'm highly concerned that Omicron, being more transmissible, circulating at the same time as Delta, is leading to a tsunami of cases.
We'll also not have a caption.
The pressure on health systems is not only because of new COVID-19 patients requiring hospitalization, but also a large number of health workers are getting sick themselves. The unvaccinated are many times more at risk of dying from either variant. Omicron is moving so quickly. In addition to vaccination, public health social measures are also needed to stem the wave of infection, protect health workers and systems, open up societies, and keep children in school.
This briefing and transcript will be posted.
In the year ahead, I call for leaders of government and industry to walk the talk on vaccine equity, both by ensuring consistent supply and helping to get vaccinations actually into people.
Director for WHO Health Emergencies Program.
This is the moment for leaders to banish the politics of populism and self-interest, which are derailing the COVID-19 response and threaten to undermine the response to the inevitable next disease X. While 2021 has been hard, I ask everyone to make a New Year's resolution to get behind the campaign to vaccinate 70% by the middle of 2022. We have 185 days to the finish line of achieving 70% by the start of July 2022. And the clock starts now. If we drive this campaign together, we will all be in a much better place by this time next year.
Normally we would do the questions and answers in.
With regards to the pandemic, we've been saying this for a very long time, the acute phase of the pandemic that's been associated with the tragedy of deaths and hospitalizations, that can end in 2022. The virus itself is very unlikely to go away completely and will probably settle down into a pattern of transmission, low level, causing occasional outbreaks in under-vaccinated populations, and we hope that that is the end game here. But we're certainly not there yet. This is going to be a bumpy road on the way to low levels of COVID.
Anyone else wanting to?
But I think the most important thing at this moment is we need to be careful about changing tactics and strategies immediately on the basis of what we're seeing in early Omicron data. Oh, it's less severe. Maybe it's not. It's more transmissible. Maybe it is. But we have to wait and see if the vaccines work or they don't work. We have to wait and see. And I think it would be advisable at this point, if we don't see huge shifts, huge moves in reducing control measures for COVID-19, purely on the basis of initial or preliminary studies.
Omicron variant. I know that
now the evidence on Omicron is just emerging, and I think it would be it's still premature to conclude definitively. But I think what we can say is that all of the lab studies are pointing towards a reduction in neutralization capacity. And also what we see clinically is that people who've been vaccinated, people who've had prior infections, are still getting breakthrough infections with Omicron. And that's why the numbers that we're seeing around the world today are extremely high, because these infections are occurring in both the vaccinated and unvaccinated people. However, it appears that vaccines are proving to be still protective, because even though the numbers are going up exponentially in many countries, hospitalizations and even within hospitalization, hospitalized people, the need for ventilation, the need for critical care, that doesn't seem to be going up proportionately.
Dr. Diaz, would you like to add something?
It is too early right now, and we still must be cautious when trying to ascertain the severity of Omicron virus infection. We do know that there are some suggestions of the reduced hospitalization coming from some countries, as was already discussed. But we need to know also, of those hospitalized, how many are on oxygen therapy, how many are requiring intensive care or mechanical ventilation, and how many are dying. So we do need to get a better understanding of that spectrum of severe disease in patients infected with Omicron. So what do we need? We need more data. We need robust analysis, and this is a call on countries that are experiencing as we heard, the co-threat of Omicron and Delta.
Thank you, Dr. Rayan, Dr. Diaz, Dr. Mahmoud, and Dr.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.